Welcome into Rounding the Bases.
Rounding the bases. Everybody knows Joe Goldberg. It's around the bases. Everybody knows Joe Goldberg. He's a man, goddamn is he.
Welcome into Rounding the Bases, presented by Community America Credit Union. Believe in Unbelievable. It's the podcast about culture and leadership with a baseball twist. And we're talking about health equity, part two of an incredible roundtable discussion. Again, as always, a quick shout out to my friends at Chief of Staff Kansas City, chiefofstaffkc.com. If you're hiring, looking to hire, looking to be placed, phenomenal resource. I highly encourage you to check them out. But I want to get right back to my esteemed panel as we continue this robust discussion. If you did not hear the first episode, I highly encourage you to do that, as we are joined once again by Dr. Ahmad Garrett-Price, Chandra Clark, André Davis. When we wrapped up the last episode, we were talking about not just health equity, but a trust and a belief that you deserve, that you have the rights to be able to take care of yourself. In a matter of life and death, you should be asked. I mean, Ahmad had a really powerful story about his brother and not knowing to ask these questions, to expect what maybe those of us with privilege expect from our doctors. And we have so many unique perspectives here. Let's see, we went ladies first last time with Chandra, so let's do that again. And Chandra, you know, working in the nonprofit world and working with rare diseases, I'm just curious your perspective on so much of what Ahmad said and how we kind of move forward.
So I think what I've really learned in my role at VHL Alliance is, you know, the rare disease community is a rarity in itself. So you find that a lot of the literature and the educational tools and resources, there are still limitations to what is geared towards community of color and underrepresented communities. And I think in my particular role, I recognized early on that we needed to really elevate our presence and really hold true to our commitment of reaching all patients from all backgrounds, regardless of their color, socioeconomic status, physical ability, that have been impacted by VHL. And that actually led me to meeting Ahmad's brother, Kwame. So I remember that Kwame got connected through VHL Alliance through supporting our federal advocacy efforts. And in full transparency, I saw the name on an email and I said, I think that might be a person of color. I want to reach out to them. And so I didn't know if it, didn't know anything else, but I remember reaching out and saying, hey, can we do an intro meeting? And Kwame gets on the call and we just became great friends. And I was so touched because he was the first Black male that I met with VHL, right? And wow. So in a sense, it was concerning to me, but at the same time, I have to be mindful that this is a rare disease. But when I think about my responsibility as the executive director of this organization and mobilizing our mission, right, to really provide diverse, equitable, and inclusive support and resources, that stood out to me. And I remember just immediately our conversation being, whatever you need, VHL Alliance is here for you. And thankfully, he had the benefit of having a brother and a father who was a physician, and his brother helping to organize his treatment plan. But what about the thousands and the millions of Kwames out there that don't have that?
That's right.
Yep.
Right. And think about the fact that Ahmad had to help steer Kwame in the right direction. And Kwame, based on, I'm guessing, what you have already talked about, Ahmad, he grew up with a father that was a physician. He has a brother that's a physician. So if anyone is going to know, regardless of color, it's probably going to be Kwame. But yet, there's still that generations full of influence there, right?
Yeah, you're exactly right. And we have reflected, trust me, amongst like as brothers, because he's also my best friend, but we have reflected on several inflection points in his care where, and that's why I say it's literally life and death. I was like, whoa, and it hits you. And first of all, it was one of the most difficult things I've ever done to be his brother, but also be, and that's another podcast, and be there knowing, what I know about the illness, about what it could do, et cetera. But there have been many points along this journey where we've said, hey, if we wouldn't have done this, or if we wouldn't have activated this, we may have a completely different outcome. And there's like 4 to 6 branch points. And you're exactly right. We say, okay, what about all the other guys that look like you, talk like you in this environment? And I was like, yeah, I've been practicing medicine for 15 years. And this is one of the reasons I spun out. I was like, imagine me observing this for the last 15 years. Right. You see what I'm saying? And that is why I, honestly took on his care after that first visit, because I did not trust that we were going to get the outcome that we needed. So that's why I made that decision, and I knew it would be difficult. And I think this is my first time expressing this, honestly, Joel. But that was part of the reason I took this on. I was like, what's the point of having this knowledge and this insight and this intelligence if we cannot use it here? So you're exactly right. And Chandra hits upon another salient point in that there has to be some intentionality in what we're doing here. There has to be an intention, right? When we shoot a free throw, I know you're a baseball guy, we're trying to make the shot into the basket. If we want health equity, if we want diversity, equity, inclusion in clinical trials, right, we have to go with the end target in mind. And it's Prostate Cancer Awareness Month, so I'll use that example again, where it's that metric, to Chandra's point, when we think about VHL, first of all, as a doctor, when you're in med school, they tell you, this is how surreal it was. They tell you, oh, this is a rare disease, you'll never see it. And you move on. And here it is in my own family. And it's, I don't think I know any other African Americans with von Hippel-Lindau. I know they exist, but it is one of those diseases literally we learn about but won't actually see. So that was a novelty in and of itself. But I say that to say that, imagine if we had a study of, 300,000 Black men, right, on prostate cancer. The screening diagnosis probably wouldn't be the age of 55, because the average age in which a Black male develops cancer is in his early 40s. So Chandra hits up, and I'm just really being technical now. You see what I'm saying? How diversity in clinical trials can literally save somebody's life, right? And so being intentional in how we design and also including everyone in the solution is of the utmost importance.
Yeah. Andre, jump in on this, because I think
I'm waiting to jump in.
Yeah, I mean, like me, you and I don't have the perspective that Chandra and Ahmad do, coming from different ends of the medical field, and I include Chandra in that. Yet you're listening to this. I know your mind is running, hearing so many of Ahmad's personal experiences too, going through it with a loved one. What are you thinking?
Many, many thoughts, and we would need to do 4 podcasts to get everything ironed out. I love that Dr. Price talked about the advocacy, sort of where we are in this country with healthcare, right? The onus should be put on the physicians and the health systems to not let that happen, to Kwame, right? It shouldn't take a brother's or a brother's physician who is a brother, right, to advocate for him. The doctor should be able to articulate that here's what you're going to experience. Here's what we think we ought to do together. Here's some routes we can take. But here's what happens in poor communities: Black, brown, indifferent. We know that there is bias in every system, right? And Dr. Price talked about the construct that we all have to work within. When you're not challenging the doctor or anything they're prescribing, then that doctor says, okay, let's just get him fixed and we'll move on to the next patient, right? And so there's this quick, let's go to the next thing, let's feed people, but you're not taking the kind of time that you need to take with patients that are poor, that oftentimes don't have insurance. And let's also talk about the generational gap that exists with healthcare, which means to say that if you're in a poor community, Black and brown, typically we see this in those communities, right, where the access to care, good health care, oftentimes, and it was exacerbated in the pandemic, you couldn't do a teledoc call. You don't have technology. You couldn't take off from your job because in those communities, you're working in jobs that don't allow you to do that. So your health care is jeopardized because your income is more important, because driving money into the house is what you need to keep the lights on, and your health care is going to suffer. So when I do go, the symptoms are already worse. There's no preventative medicine. You're just trying to figure out, how do we get you healthy enough to go back home, maintain your family, and do your things? The onus should be put back and should be put on. There are some physicians that are amazing. And I'm sure Dr. Price has an amazing bedside manner. I think it's personal. It is personal for him. So he's not going to just scoot out of in and out of patient room to speed up and get through the day. He's going to spend the necessary time with his patients. And we don't have that happening probably as regular as we may think, especially with poorer communities. And if we don't have the knowledge to challenge, why would we challenge? We already have a feeling about what healthcare is for Black and brown communities, right? You go in, they're going to tell you sometimes what you already knew when you came in. It's going to cost you money to do that. We're going to prescribe medicine which you can't afford. So then why do I go? If I don't have access to any of those things, then I'm better served just managing and doing what I have to do and staying sick. And I'm not going to have, because no one's advocating for me. So this is such a big problem. And I looked at it from a purview that in the pandemic, where my family, right, we had access to all the immunizations and things like that. We got our shots. We had teledoc calls. We had access to it. If I'm in a poor community, and in Kansas City, what we recognize in the pandemic, I know we're talking about in the pandemic, what we recognize is even our kids, right? When they got sent home, many of our kids in the urban schools had no access to technology. And so a lot of what school systems had to do was park buses in neighborhoods because the buses had Wi-Fi and allowed those kids to access Wi-Fi. If the kids don't have Wi-Fi, that means the parents don't have Wi-Fi. So you can't go anywhere. And then you talk about transportation being a hiccup. Well, how do I get there then? How do I go get my shots to get vaccinated? And then how do I feel about vaccination? Man, there is so much we can talk about that prevent poor communities from accessing care. And it's not just our current generation. It is so generational that even when I talk to people of color, hey man, you getting your vaccine? Oh no, you know what they did back in the day? I know, but that was like 80 years ago, but we're here now. And I got my shot. And so there's still that, and that transfers down to other generations. So this is such a big, I have a mother that's 77. I advocate for her health all the time. Now she's stubborn. She's from that New York side, man. So she's super stubborn, but I'll challenge her. Hey, did you go get this done? No, I was thinking about going next week. No, we need to go and get that done. Let's call right now. I'm here. You have your phone. Let's do that. So we have to advocate for our seniors, but we also have to set the stage that we're going for preventative care, right? So we have some things that we have to do as a Black and brown community too, to go, are we getting our checkups not at 55, but at 42? I was asking for prostate and things like that in my 20s because I was trying to be preventative, and I wanted to be a promoter of that, right? I cared about my health and still do. Not many people, and there's a fear factor too, right? So if you're fear of what you might learn in the visit and you can't afford to mitigate that, then you don't go. So there's such a gumbo mix of this, but but that's the complexity that is healthcare when you're trying to access it.
Right. And I think about, Ahmad, I often will see the image, at least my observations. If I am in the Black community, if I am in a store in the Black community, if I'm at a gas station, whatever it is, and I'm in, every neighborhood around Kansas City, actually, I mean, in my previous jobs, I was in every type of neighborhood because in my early work, I was always covering the high school sports. It was one of the greatest privileges of my career and one of the most eye-opening things because I could go into the school with the $1 million homes one day and through the metal detectors the next, and never thought twice about it. And it's a good perspective to have, to see the way that people are living, and that there are differences. And it is healthy to go to the other side of the track, so to speak, whatever that means. It is healthy to be different than everybody in the room or standing in that store. And I'm always amazed in the last year, 2 years really, that oftentimes when you go into the Black community, in a parking lot, by a store, you will see more, at this point, more masks than anywhere else, which, unless I'm reading it wrong, tells me that these are people that decided not to get the vaccine, but they're doing their best to take care of themselves and stay healthy and avoid it. Now, we all know medically and scientifically, there's a lot of politics that went into this, which is a totally different discussion, that the vaccine is going to save lives. The vaccine is going to keep us out of the hospitals. The vaccine is going to keep from inundating the hospitals, on and on and on, right? But if you don't have the trust, and it's, as Andre talked about, 80 years or whatever it is, of saying, well, wait a minute, they never took care of us before. I don't want to be the test on this one. And then if you can't afford to get that health care, then what are you going to do? They're not anti-mask. They're just trying, again, life or death, as Ahmad talked about. So how do we bridge that gap? Because within the Black community, within the community of people of color, there's a lack of trust within the government. But at the same time, we could save lives here. How do we get there?
You know, I like what Andre said a lot, because it really brought me back to why I actually started GP Health and why we started our company, is that we understood that when we were seeing people, especially, you know, those from our BIPOC communities, they were already sick. This is just going to be a vicious cycle until, quite honestly, there's a poor outcome. So you're exactly right, Andre. And I just wanted to say that, in that this proactive preventative approach and moving further upstream is what communities of color need. We're not sick because we don't have enough insulin. It's because we don't have enough, right, education, health literacy, and no one's taking a different approach. And that's the definition, right? It's taking a different approach for the desired outcome. But Joe, you're exactly right. Trust is it's a core tenet of GP Health, but also if you're trying to infuse DEI and health equity, you know, to me, trust is everything, right? Before any therapeutic or really any relationship, if you think about it, can commence, there's got to be trust. And to earn trust, you have to be there. You have to be in these communities. There has to be a outreach. You need to have a presence. The great Bernard Tyson, who led Kaiser Permanente until his untimely passing, maybe 4 or 5 years ago. And that was kind of, everybody's like, oh, what do they do at Kaiser? It's like, well, they're in the community. They're there. They're visible. People can see them. They may deliver groceries. They may do sustainable housing, right? Again, only 20% of a health outcome is clinical. The other 80%, who we are, where we are, social constructs. So we have to be that and live that and be present. Second, there's got to be empathy, meaning that I care about you, brother, sister, him, she, they, everybody. It's just a basic human thing. Like, I understand you, you understand me. Now we can work together. And then per Chandra, designing with the end in mind, cross-sectional partnerships, partnering with community organizations, right? Not just saying, hey, I'm a healthcare organization. Well, let me go partner with a organization in that community that community respects. Let me be visible. Let my dollars, if you will, do the talking, and also my social equity do the talking here, right? And also access, right? And Andre's correct, not just who we have access to, not just having access, but we have to have access to folks who are knowledgeable about the issues that exist, right? Because there's two layers. I see this differently as like, because you can have access and still get a bad outcome. It's kind of who and what you have access to. And then, you know, that is really, to me, how you start to bridge the gap, right? Think about it. If somebody's trying to penetrate your personal world, they have to show you, right, and earn that trust to be in that space, for sure. And lastly, but surely not least, but set goals, much like we would do anything else. We have to set goals and we have to measure the outcomes. Like, are we being effective in our efforts? So.
or there's so much there. And, you know, as I process it all, Chandra, and you've heard me say this before, it's not profound, but I just think it's a great way to describe it. Life is hard for everyone. All right. Not shoot, even a billionaire has to deal with something, but their climb is not as steep as others, right? And my climb at times might feel steep. But as I said to you, Chandra, as a woman of color, you've always had to walk up a steeper hill. And so we could fill in the blank for any of these discussions. And if you start adding up all of the extra effort that someone of color, someone in a poor community, or all of the above has to go through, the hill is much steeper and you may not get off the bottom level. And that's what people are dealing with their whole lives. So if we take this into a bigger picture here and talk about the pandemic, and maybe you don't have access to the vaccine, or maybe you do have access to the vaccine, but you don't trust it, or maybe you do trust it and you do have access to it, but you're not aware of it because the communication is not there. And oh, by the way, you're trying to, as André said, keep the lights on. And you've got to get to work, which means that your kids don't have anyone at home to watch them. Work from home, hybrid working, that's probably not available. Okay, yeah. There's no Wi-Fi. So how are your kids getting educated? Who is watching them? Oh, by the way, they're eating really poor food because the only food available in the neighborhood might be a convenience store or fast food. And hey, a cheap meal is better than no meal at all when it comes to putting so on and on and on, right? I mean, I've just talked about 5 or 6 things, not 50 things that have the hill getting steeper and steeper and steeper. Just curious your perspective on it, Chandra, and so much of what Ahmad was saying there, because we do all have to work together. I think that trust piece, it's my favorite topic to talk about just in building teams and in building cultures. It also, trust involves community.
It does. And I think also hope is what I think of. So I think if you look at it, I kind of do things in 3 different buckets. So one, I think the responsibility of instilling the message of hope. And it is through hope that you open up people to being receptive to the education. So as Ahmad talked about, it's not just the access, it's the education. And it's educating them on the fact that they can make the choice to be the first in their family to break a generational cycle. So I tell everyone who knows me, I am a Southern girl. I am proud of my Creole heritage from Lake Charles, Louisiana. And I grew up with my mama and my papa, so my grandma and my grandfather. And I remember my grandfather having high cholesterol. My papa ate boiled eggs every morning with bacon, okay? Greasy bacon. He died of a heart attack. I remember my mama would send me down the street to the lady who had the candy store in her home every day to buy her candy. My grandma died of diabetes and had lost both of her legs by the time she passed. And I remember going to doctor's visits, and I just also remember my mom telling me that she knew that my grandmother was not having the proper care. But we were in Louisiana, and we lived on one side of the town, and there were only certain hospitals that we could go to, and there was only certain care she could receive. And so I come again from a population of people where systemically, like we are true, my family, true Louisiana. So true, has a story about everything. You can't go across the street because something happened there 100 years ago. You can't go to this store. You can't go to that store. And so even as I reflect on my parents now and how they care for themselves systemically, just carrying that same legacy, right? But I think when you talk about access, you also have to talk about exposure, Joel, because it's through my conversation with you. It's through my conversation of communities that are not people of color that helped me move out of the mindset of woe is me, right? Because again, if you've been dealt these cards where it seems that the whole system and the whole world is against you, why would I show up for myself? Why would I make the choice to change the way I eat or to go to routine visits? Why would I make that choice? This is just the way it is. But when you can engage in those organic human conversations that we all have a story, we all have pain, we all have struggled, and yet we all have a choice that we can create new legacies for our families and future generations. That comes down to hope, education, and then access, in my opinion.
Yeah.
Wow. Yeah. Andre, jump in on that.
Yeah, let me throw a little few things out too. I love all that. I think for the folks that are watching, I think we have to also acknowledge that if we're bringing up what the challenges are, right? There are organizations that are stepping in and helping some of that. You know, we in Kansas City, and I won't name them, but there are organizations every Wednesday that are giving away, you know, fruit and healthy food. There are systems in Kansas City that have implemented for the first time ever diversity, equity, inclusion professionals into the system, where they're changing who your vendor is, who your suppliers are. The outreach is different. There are foundations that are also reaching out to those people that are at high risk in terms of healthcare issues. And so there is work happening. And then what triggers me for that is just because Chandra and Dr. Price talked about community. It affects everything, right? And if you're not healthy, there's so much that is affected. How you think, when you do drive, are you under the influence, not of alcohol, but deprivation of what you fill in the line, right? And there's so many things that we have to think about. And what are the triggers and what are the outcomes from people being under the influence because they're not healthy, behind the vehicle, driving our kids to school on a bus, flying aircraft, all these other things that we don't think about. But there are organizations that are really trying, and we just need to understand. And when I talk to CEOs and coach people and do all this work, right, one of the things I always ask them is, don't let your data be your emotions. Let the data be the data. Go off the data. Let the data, if you look over the last 2 years of the people, of the deaths that happened from COVID, high percentage were Black and brown and poor communities. Because when they went into systems and said, I think I have COVID, they go, well, no, you probably don't. You just probably need to go home and rest, right? There was that, and there was no advocacy. So if we looked at the data and we let our data drive that, it would be different. And here's what I hear, and here's the juxtaposition, right? So then if we flip that and we said, what if in this country there was data that came out that said that there were a whole bunch of white people that were getting COVID and being turned away from hospitals? The system may change, right? It's always different when it's a different demographic, right? And so we have to look at those biases. Biases are in every industry that exists in America, and we have to acknowledge. And I think there are systems there are organizations that are acknowledging that and trying to do the work. But this is not a Black or brown thing. It's an everyone thing. Doctors have to be at the table when they see someone brown and Black come in and ask about what is your environmental situation right now, right? Tell me about how you live. What part of the city do you live in? If you look even at the part of cities where Black and brown communities, you would see most of those communities live around industrialized businesses. You don't see suburbs where you have an industrial plant 3 miles away. There is an environmental factor that affects healthcare that we haven't even gotten into yet that we could talk about. And what is that doing? Access to clean water. We could talk about that. What is that doing to my ability to be focused for a set amount of time? I mean, it is pretty damn unbelievable when you think about how, and then we wonder why those poor communities, why aren't they performing well in school? Well, if you had horrible water to drink and you had horrible food, you probably wouldn't perform well either, right? And so, but we just don't, and that gets to the bigger part what we talked about in the beginning of the show, which is, what if we just took time to understand as a doctor, Dr. Price, that if we understood to go, tell me about where you live and then tell me about your home, and a little instance like that where you show the empathy and the care and you go, well, tell me, so when is the last time you had vegetables and things in your diet. And what was that? If we just took that care and then made sure we had resources from a system perspective. So I just had a patient, they have no vegetables, they have no access to this. What could we do from a system perspective to help this family? And that to me is where the healthcare needs to go, is addressing that. We're starting to see that in the mental health arena a little bit, where systems are bringing in mental health professionals. It's not widespread yet, but I think that's where it's going to head.
Agreed, Andre. And we do that we do that at GP Health. When's the last, and that's where the care starts to mold in a really personalized treatment. That's where we think care should go as well. So I'll back you as a health professional. My questionnaire is, I want to know your medical, family, social history. I also need to know where you live. I also want to know what you have access to. I also want to know, what do you eat for breakfast, lunch, and dinner? Are you sleeping? Right? Can you pay your bills? Because those are actually the things that are going to affect how we care for you. Right. And if so, we need to support that. And it's not the sole job of GP Health to do that, but we need to take those factors into account and build out the resources to connect those two when those issues come to bear, because those are actually, we call them key drivers of health. Those are the things that determine whether folks are going to be healthy or not. So sorry, I just had to chime in, Joel.
No.
He said some good stuff.
It's great. And this all gets back to a couple of really important words that you all have used: trust, empathy. I'll add in curiosity as something too, because when you're curious about someone, it leads to greater empathy. I refer to empathy as walking in someone else's shoes. You can't be empathetic and walk in their shoes without being curious, and you can't build trust until you kind of live in their world a little bit. Once all that happens, that's how you build successful teams. That's how you build good communities. And so, to me, that's what's going on. This is not. There's nothing involving race here. Not that there needs to be, but my wife and I switched over to direct primary care a handful of years back, and as someone that doesn't have insurance, because I'm an independent contractor, that made a lot of sense to us, paying the subscription model. But what shocked me at first, and it jarred me, was that I might go in to visit my doctor. I'll give an example. Last year, I went in for my physical, and we never got to the physical because we spent an hour just talking about what was going on in my life and some other things. And it was like, wait a minute, doctors don't do this, right? It wasn't like a session with a therapist. It was just had some things going on, and okay, just come back. We'll do the physical. We could do the blood work now. And I was like, wait a minute, but it doesn't work this way. Wait a minute, it can.
Yep,
and so my point here is that, again, getting back to the tradition, well, it's always worked this way, and it's put a lot of money in people's pockets. And if that's the only way you've ever been told, you stop questioning it. And to what Ahmad had said before about his brother, no, you should always be asking questions. So just a little bit of my perspective on things. I want to go around the horn, the table, whatever we want to call it, for a final thought, wherever you want to go in terms of health equity, access, community, wherever anyone wants to go. And I will start with Andre.
Of course you want. I'm ready. I'm ready for you. So first of all, I love this discussion. It is, and I love hearing, Dr. Pratt. I love the personal thing that you shared about your brother, and then obviously with Chandra, the connection and how it all happened. I think what I would want to leave people with is just advocate, right? Advocate for not only you, but those in your sphere, right? If you see people, and then we as professionals and organizations, we need to be advocating and creating psychological safety within our organizations, that if we know someone is not performing well, Joel just talked about it, the empathetic thing to do is to pull them aside and say, how are you? How's things going? You're not someone, what are you experiencing? Not get into HIPAA, not get into all that, but ask people how they're doing. And maybe they'll tell you, I've just been under the weather. Well, maybe you should take 2 days off, and give them the autonomy to do that, and encourage them that they can take time off to get better, whether it's mental health, checkups, whatever that is. But just advocate for those around you, that when you see people that are struggling, not all of us are struggling with either mental health. There might be a breathing thing that we're struggling with that we just haven't figured it out, and advocate for that. Suggest that they go and encourage them. That if we just did that, we could really make a dent on other things, and that's the community piece of it. So that would be what I would want to leave people with, is just be your brother's keeper, right? And just be aware of people and their struggles, and be someone that would be willing to step in and direct them to better resources to get the answers they need medically.
Well said. As always, Chandra, you are next up. I'm leaving the good doctor with the last word. So Chandra, your thoughts wherever you want to go.
I like to leave our conversation. This was wonderful. So thank you all for this opportunity today. It's two things. Representation matters at every level, and stories also matter. I think it's just really critical that we continue to create opportunities to engage in real, transparent, and authentic conversation. So that way we know that we truly are proponents of creating a sense of community, and that we're not alone. We know that the pandemic, it has taken a toll on all of us. Mm-hmm. And the isolation and the deprivation is real. And so I think, Joel, I always have to thank you for utilizing your platform to have the uncomfortable conversations that are also the critical conversations.
Yep.
And also being a true ally and saying, this is what I can do, this is what I can't do, and being strong enough to understand that some people will receive that and some people will not. But that doesn't take away from the legacy that you are called to leave in this world. So that is what I'd like to leave everyone with.
Well, I appreciate that. And they're important conversations, and they can't stop. They have to be happening, not just on one guy's podcast. They should be happening in the office, at work, around the water cooler, in the communities, wherever, everywhere. I mean, we need to be able to talk about it and not brush it under. And that's hard to do. Understandably, in the day and age, the world that we're living in. So we'll go to Dr. GP. Ahmad, how about a final thought from you?
Yeah, this has been wonderful. And so thank you all for creating the space. But just to draw on everyone, trust is paramount. Let's continue to build trust and be there for each other as human beings. Let's show each other a little grace, a little empathy. On a more formal professional side, let's continue this dialogue and continue to partner to move towards a solution, right? Because, at the end of the day, health equity and just equity in general is a team-based sport, no pun intended, but it also can improve the quality and longevity of all of us, right? Mm-hmm. And no matter where we're from. So we all want to be participants in this effort, for sure.
Well said.
Perfect way to end it. And this has been fantastic. If you are listening to the end of this episode and have not checked out the first episode, I highly encourage you to do that. It I believe is an easy listen, but also an important and informative listen as well. So a huge thanks to my good friends, longtime friends now, it feels like, André Davis and Chandra Clark, and my new friend, Dr. Ahmad Garrett-Price, who I hope I could see you down in Texas next year, get you to a Royals-Rangers game. Chandra blew off the opportunity to go to Fenway to Royals.
What's wrong with her?
She had something important.
Non-sports person on this
You were going to go. You were going to go, but you had something more important, like a fashion shoot or something like that going on the next one.
I did. I had a photo shoot. Like, that's more.
It's like, who am I to bring this? Who am I to bring this amazing woman to a baseball game at the most historic, best stadium in baseball?
Just Fenway.
It's not a big deal, right, Dr. Price?
I had a photo shoot, Ahmad, and it was crying.
You should have done it at Fenway.
Totally. That's what I was going to say.
Right on the Green Monster.
Photo shoot.
Think about this. Here we go. We're unleashed now as we're wrapping this baby up. But Chandra, if I had told you from a historic standpoint that Fenway Park opened the same week that the Titanic sank, maybe that would have had some appeal, right?
Right.
So
she never saw the Titanic.
He told me that, and I still was
Still didn't work.
One of my dear friends and her husband are coming to Boston next week, and he loves baseball. He wants to go to Fenway, and I will find my way out of that tour. I'm sorry.
Wow.
Well, the good news is I don't even know if they're in town, and as we're recording this, the season ends early next week, so you might be off the hook. You might not have to go.
Right.
With all that said, give everybody that's listening a little peek into some of the humor and the fun here in the relationships. André, Chandra, Ahmad, thanks so much for doing this really important conversation. Appreciate you all.
Thank you for having us, man.
Thanks for having us.
Loved it all.